15 early signs of heart failure you should never ignore. Did you know that more than 50% of people diagnosed with heart failure die within just 5 years, according to the American Heart Association? That's a staggering fact that highlights how dangerously silent this condition can be. What makes heart failure so frightening is that it doesn't strike all at once. It creeps in slowly, often disguised as simple tiredness, aging, or stress. The World Health Organization estimates that over 64 million people worldwide are living with some form of heart failure, and many don't even know it until it's too late. Early symptoms like shortness of breath, fatigue, or mild swelling in the legs are often ignored, dismissed as minor issues, while in reality, they're the body's desperate warning signs. Heart failure means your heart isn't pumping blood efficiently. And if you overlook the subtle clues, this gradual decline can quickly turn into a life-threatening condition. The good news is that when detected early, heart failure can often be managed, treated, and even reversed with proper care and lifestyle changes. Awareness is your strongest defense. Recognizing these early red flags could literally save your life or the life of someone you love. In this video, we'll explore the 15 early signs of heart failure you should never ignore, based on medical research and real-world experiences. Because when it comes to your heart, every beat counts, and every symptom matters. 1. Shortness of breath, dyspnea. Have you ever felt out of breath after doing something simple, like walking up the stairs or lying flat in bed? That breathlessness could be more than just being out of shape. According to the American College of Cardiology, shortness of breath is one of the earliest and most common signs of heart failure. When the heart can't pump blood efficiently, fluid begins to back up in the lungs, making it harder for oxygen to reach your body. You might notice this especially when lying down, forcing you to prop up with extra pillows or wake up gasping for air at night. Many people ignore it, blaming age, asthma, or lack of fitness, but persistent breathlessness deserves attention. Studies show that people who report early symptoms of breathlessness are up to 3 times more likely to develop heart failure within 5 years. So if your lungs feel heavy or your breathing feels different, your heart might be sending you its first silent warning. And shortness of breath is just the beginning. The next sign hides in your body's everyday energy levels. 2. Unusual fatigue or weakness. Do you feel tired all the time, even after sleeping well? Fatigue might seem harmless, but it's often an early red flag that your heart is struggling. The National Institutes of Health, NIH, explains that when your heart weakens, it can't pump enough oxygen-rich blood to your muscles and tissues, leaving you drained, foggy, and sluggish. Everyday tasks like carrying groceries, climbing stairs, or even taking a shower might suddenly feel exhausting. What's worse is that this fatigue often develops slowly, so people don't notice it until it's severe. According to a 2024 study published in the Journal of Cardiac Failure, over 70% of patients reported experiencing unusual fatigue months before being diagnosed with heart failure. Your body is smart. It's trying to conserve energy because your heart isn't keeping up. If rest doesn't fix your exhaustion, it's time to listen to what your body's whispering. And if your energy's low, your body might also start showing visible clues, like swelling in your feet or ankles. 3. Swelling in feet, ankles, or legs, edema. Notice your shoes feeling tighter lately? That could be more than just water weight. Swelling in your feet, ankles, or legs, known as edema, is one of the clearest physical signs of early heart failure. When your heart's pumping power weakens, blood flow slows, and fluid starts leaking into surrounding tissues, especially in the lower body where gravity pulls it down. According to the Cleveland Clinic, around 60 to 70% of early heart failure patients experience noticeable swelling before diagnosis. This swelling might seem harmless at first, but it often gets worse by evening or after long periods of standing. You might even notice fingerprints left on your skin after pressing it, a telltale sign of fluid retention. Many mistake this for kidney or vein problems, but it often points directly to heart inefficiency. And while swelling shows what's happening on the outside, the next sign reveals what's going wrong deep inside your chest, your heart's rhythm itself. 4. Rapid or irregular heartbeat, palpitations. Have you ever felt your heart suddenly race, skip a beat, or flutter for no clear reason? Those odd sensations might not be anxiety. They could be palpitations, another early warning sign of heart failure. When the heart starts to weaken, it tries to compensate by beating faster or irregularly to keep blood flowing. According to the Mayo Clinic, irregular rhythms like atrial fibrillation are found in nearly 50% of people with developing heart failure. These rapid beats can make you feel dizzy, lightheaded, or anxious, and sometimes you can even feel them pounding in your chest or throat. Many brush them off as stress or caffeine effects, but frequent palpitations signal that your heart's electrical system is under pressure. Ignoring these episodes can allow silent heart damage to progress unnoticed. And if your heart's rhythm is changing, your body might soon start showing the effects, starting with a surprising one: sudden, unexplained weight gain. 5. Sudden weight gain. Gaining 2 to 3 pounds overnight or 5 pounds in a week. It's not just diet. It could be fluid buildup from early heart failure. The American Heart Association warns that sudden, unexplained weight gain is one of the most reliable indicators of worsening heart function. When your heart can't circulate blood effectively, fluid leaks into your tissues and organs, causing rapid weight changes that no exercise or diet can explain. Patients often mistake it for bloating or normal fluctuation, but it's actually your body retaining fluid in response to a failing pump. A study from a European Journal of Heart Failure found that people who gained over 4 pounds in a short period were twice as likely to be hospitalized for heart complications within weeks. The key is to monitor your weight daily. A sudden jump might mean your heart needs immediate medical attention. And while weight gain is visible, the next sign hides in your nighttime routine. Your heart might be waking you up for help. 6. Frequent nighttime urination, Nocturia. Do you find yourself waking up several times at night just to urinate? That may seem harmless, but it could be an early clue that your heart is struggling. When you lie down, gravity allows fluid that is built up in your legs and ankles during the day to return to the bloodstream. Your kidneys then try to remove this excess fluid, causing you to make more trips to the bathroom. The American Heart Association notes that frequent nighttime urination is one of the first overlooked signs of fluid overload in early heart failure. It's not just about inconvenience. It's your body's way of saying there's too much pressure in your circulatory system. Studies have shown that patients with nocturia are up to 1.8 times more likely to develop heart failure than those who don't experience it. So, if your sleep is constantly interrupted by nature's call, don't just blame it on age. It could be your heart trying to get your attention. And as your sleep gets disturbed, your appetite may start to fade, revealing the next silent sign your heart is in distress. 7. Loss of appetite or nausea. Have you ever felt full after eating just a few bites or lost interest in food altogether? That queasy feeling could be linked to your heart, not your stomach. When heart failure develops, poor circulation and fluid buildup can affect the liver and digestive system, causing discomfort, bloating, and loss of appetite. The National Heart, Lung, and Blood Institute, NHLBI, explains that as the heart weakens, blood backs up in the veins connected to the stomach and intestines, leading to nausea or even vomiting. Research in the European Journal of Clinical Nutrition found that more than 45% of early heart failure patients reported appetite loss before diagnosis. This symptom is especially dangerous because it can lead to malnutrition, further weakening the body and heart. If you're losing interest in food or feeling full unusually fast, it's time to look beyond digestion. Your heart might be the hidden cause. And while your stomach feels full, the next sign makes another area of your body swell. This time, your abdomen. 8. Swelling or fullness in the abdomen, ascites. If your belly feels tight, bloated, or noticeably larger, even without overeating, that could be ascites, fluid buildup in the abdominal cavity, often caused by heart failure. As your heart's pumping ability weakens, pressure increases in the veins that carry blood from your organs back to the heart. This pressure forces fluid into your abdominal space, making your waistline expand. According to the Cleveland Clinic, ascites can cause not only visible swelling, but also a feeling of heaviness, discomfort, or difficulty breathing after meals. Studies show that up to 30% of patients with early heart failure experience mild abdominal swelling before more obvious symptoms appear. Many people confuse it with weight gain or digestive issues, but if bloating doesn't go away, it's worth checking your heart function. And while swelling can make you uncomfortable, the next sign can cloud your mind, literally, by reducing the blood flow to your brain. 9. Difficulty concentrating or confusion. Have you noticed moments where you feel foggy, forgetful, or can't seem to focus like before? This mental fuzziness can actually be caused by heart failure. When your heart isn't pumping effectively, less oxygen reaches your brain, and over time, this lack of oxygen can affect memory, alertness, and concentration. The Journal of the American Geriatric Society found that cognitive decline is one of the earliest, often overlooked symptoms of heart failure, especially in older adults. Patients frequently describe it as feeling mentally tired or not sharp. In fact, research shows that people with early heart dysfunction perform 20 to 30% worse on memory and reaction tests than those with healthy hearts. It's not your imagination. It's your heart's reduced output affecting your brain's performance. If you find yourself unusually forgetful or mentally slow, it might be more than stress or aging. And if your mind feels foggy, the next sign might bring something even more alarming, tightness or pain in your chest. 10. Chest pain or tightness. A sudden pressure, heaviness, or squeezing in your chest shouldn't be taken lightly. Chest pain is one of the most well-known warning signs of heart trouble. In the context of heart failure, it often signals the presence of underlying coronary artery disease. When arteries become blocked or narrowed, the heart muscle doesn't get enough oxygen, forcing it to work harder and eventually weaken. The American Heart Association reports that chest discomfort is present in nearly half of heart failure cases, often appearing long before full-blown failure develops. The pain may come and go, sometimes spreading to the jaw, shoulder, or back, and can feel like pressure rather than stabbing pain. Many people ignore it, thinking it's just indigestion or stress, but delaying a checkup can be deadly. If chest pain appears with shortness of breath or dizziness, it's time to act fast. And if your chest feels cold and tight, the next sign might literally make your hands and feet feel the same, freezing from the inside out. 11. Cold hands and feet. Have you ever noticed your hands or feet feeling unusually cold, even in warm weather? That chilling sensation could mean your heart isn't circulating blood effectively. In heart failure, the body prioritizes sending blood to vital organs like the brain and lungs, leaving the extremities with less oxygen and warmth. According to the American College of Cardiology, poor circulation in the limbs is one of the earliest peripheral signs of a weakening heart. You might also notice your fingers turning pale or bluish, a condition called cyanosis, which indicates low oxygen levels. A Harvard Medical School study found that reduced peripheral blood flow is present in more than 40% of patients with early heart failure, often before other major symptoms appear. So if your hands and feet are constantly cold or numb without a clear reason, your circulation and your heart may already be under stress. And when circulation drops further, that bluish tint can spread to more visible places, like your lips and fingertips. 12. Bluish lips or fingertips cyanosis. Have you looked in a mirror and noticed your lips or nail beds turning slightly blue or purple? This isn't just about cold weather. It's a dangerous signal of low oxygen in the blood, known as cyanosis. In heart failure, the heart's weakened pumping action fails to deliver enough oxygen-rich blood to your tissues, leading to visible color changes in areas with thinner skin. The Mayo Clinic reports that cyanosis can appear in early heart failure when oxygen levels drop below normal, even before other symptoms become severe. It's your body's way of saying it's running low on fuel. Some people notice it when exerting themselves, while others see it constantly. Studies have shown that patients who experience mild cyanosis are at a higher risk of progression to advanced heart failure if not treated early. If your lips or fingertips turn bluish without cold exposure, it's not something to brush off. It's a sign your heart may not be keeping up. And if your body isn't getting enough oxygen, the next symptom will make everyday activities feel almost impossible. 13. Decreased exercise tolerance. Remember when a short walk or a few stairs didn't leave you gasping for air? If those same activities now feel like a workout, your heart could be the reason. One of the clearest early signs of heart failure is reduced exercise tolerance. Your body simply can't handle the same level of physical effort as before. The Journal of the American College of Cardiology notes that decreased stamina often appears months or even years before an official diagnosis of heart failure. The weakened heart can't deliver enough oxygen to your muscles, making them tire quickly. You might find yourself pausing more often, feeling unusually winded, or needing longer recovery time after activity. Many people dismiss it as getting older, but research shows that a sudden drop in exercise capacity increases heart failure risk by up to 60%. It's not just about being out of shape, it's about your heart struggling silently. And when your activity levels fall, even your sleep might start to betray you, especially when you wake up breathless at night. 14. Sleep disturbances, paroxysmal nocturnal dyspnea. Do you ever wake up in the middle of the night, gasping for air, or find it impossible to lie flat without feeling suffocated? This distressing symptom, known as paroxysmal nocturnal dyspnea, is a hallmark of early heart failure. When you lie down, fluid that is pooled in your lower body during the day shifts back into your lungs, making breathing difficult. The American Heart Association explains that this nighttime breathlessness is often mistaken for asthma or anxiety, but it's actually fluid congestion caused by poor heart function. You may find relief only by sitting upright or using multiple pillows to sleep. According to a study in the European Heart Journal, people who frequently experience nocturnal breathlessness are 2.5 times more likely to develop chronic heart failure. If your nights feel restless and you wake up gasping or coughing, your heart might be working overtime while you sleep. And when your nights become restless and your days feel heavy, the final sign can be subtle, a quiet feeling that something deep inside just isn't right. 15. General feeling of something's off. Sometimes your body knows before any test does. Many people in the early stages of heart failure describe an uneasy, hard-to-explain sensation, a sense that something just isn't right. It could be mild chest heaviness, random dizziness, or an overall decline in well-being. Doctors call this a nonspecific symptom, but it's often one of the earliest signs your body gives before major symptoms appear. A study from the British Heart Foundation revealed that nearly 1 in 3 heart failure patients had vague feelings of discomfort or fatigue weeks before diagnosis, yet most ignored them. This sense of unease comes from subtle imbalances, reduced circulation, oxygen deficiency, and hormonal stress responses. Your body is whispering before it starts to scream. Listening to these whispers can literally save your life. If you feel off for no clear reason, don't wait for it to get worse. Get your heart checked. Because your heart doesn't stop overnight. It warns you first. The question is, are you listening? Your heart beats more than 0.1 million times every single day, working silently to keep you alive. But when it starts to struggle, it doesn't quit suddenly. It whispers through symptoms. Those whispers might sound like shortness of breath, swelling in your feet, or fatigue that just won't go away. Sadly, millions of people mistake these warnings for stress, aging, or tiredness until it's too late. According to the World Health Organization, heart failure is responsible for over 9 million deaths each year. Yet most of those lives could have been saved through early detection and lifestyle changes. The truth is simple. Your heart never fails overnight. It fails quietly over time. Catching the signs early gives you the power to reverse the damage, strengthen your heart, and regain your energy in life. Regular checkups, heart-healthy habits, and awareness are your best defense. Don't ignore what your body is trying to tell you. Those small symptoms could be your biggest lifesavers. If this video helped you understand the early signs of heart failure, make sure to like this video, share it with your loved ones, and subscribe for more health awareness content. You never know, a single share might help someone recognize their symptoms and get treatment before it's too late. Remember, your heart is talking to you every day. All you have to do is listen.